Do you have an associate's degree or a bachelor's degree?
A bachelor's degree.
And how long have you been a nurse?
For 4 years.
And what would you do for a patient on seizure precautions?
For a patient on seizure precautions, we would pad the bed or the crib, make sure the bed was low to the floor, have them on a continuous pulse oximeter, and have suction and oxygen readily available. We would also have the rescue meds that we needed available, and make sure we're doing neuro assessments and vital signs that we need.
Okay, and what or how would you educate a patient about seizures?
We would educate them on making sure they take their medications as prescribed, making sure that if they do have seizures at home that they're documenting them and giving proper rescue medications if they need and knowing how to administer them, and also on safety to just let them know that they can't bathe or swim alone, just making sure that they're not doing any activities that if they were to have a seizure during the activity they could seriously injure themselves.
Thank you. Do you have an associate's degree or a bachelor's degree?
An associate's degree.
And how long have you been a nurse?
A year and a half.
Okay, and what would you do for a patient on seizure precautions?
I'd make sure I had suction set up at the bedside, O2 set up at the bedside, seizure precautions on the wall, a sign on the wall, or on the outside of the door. They'd have their side rails padded, and
Okay, and how would you educate a patient about seizures?
I would find out what kind of seizures they were having first. I would get information from the Emily Center or my paramedics and go through it with them on what to look for, what the signs and symptoms are, the fact that there can be different kinds and that they can change, what medications they were going to be taking to control them, what precautions they need to take at home, like padding their side rails, bed low to the ground, near a family member's room, kind of assess their home situation first, and then decide what I need for discharge. Depends on how long they're going to stay in the hospital, what I need to tell them about our hospital precautions, basically the same as a seizure precaution. That's probably it.
Okay, thank you.